Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we'll be looking into the forceps. So what are present in forceps? The first one is the Kocher's hemostatic forceps. So Kocher's hemostatic forceps, it includes a tooth and the groove at the tip of the firm tip. So tooth and the groove is present. So it has presence of the transverse serrations. The uses is it is used for the hold the pedicel. So to hold the pedicel. Next is the tough structures, and then the cut end of the muscles. Thyroidectomy. So there's thyroidectomy, the hemorrhoidectomy, the mastectomy, the polypectomy, as well as the hysterectomy. Next is it is used to hold the tough and the fibrous structures. Tough and the fibrous structures like the palms, then the scalp, to prevent the retraction of the vessels during the surgery. It is used to hold the gauze for the blunt dissection. So hold the gauze for the blunt dissection, to hold the resected bowel, and to hold the ribs during the ribs resection. Next is we move on to the mosquito hemostatic forceps. So here in the mosquito hemostatic forceps, has a fine pointed tips. So it is a fine pointed tips. So fine pointed tips with transverse serrations. So fine pointed tip, it has a transverse serrations. The uses, it is used in controlling the fine bleeding. So control the fine bleeding, and also the puncturing of the mesoappendix, and the puncture of the mesoappendix. Next, we move on to the Spencer-Wells hemostatic forceps. So here in the Spencer-Wells hemostatic forceps, what is it and how is it? So here it has a conical tip. So there is a conical tip. You have a half blade length. There is a half blade length. So there are presence of the transverse serration. So there is presence of the transverse serrations. Next is, what is the use of this? The use is it is holding the bleeding vessels. So it is used to hold the bleeding of the vessels, and splitting the fibers in the appendectomy, Now next move on to the right angle forceps. So here in right angle forceps, it is also known as a Leahy's forceps. So what is the use of this forceps? So the terminal part is at the right angle. So it is at right angle. That's why it is known as a right angle forceps. And the transverse serrations on the inner aspect. So there are also the transverse serrations are present. The uses is it is a dissecting solid organ pedicel. It is a dissecting solid organ pedicel, and it passing ligature. It has a passing ligature, and catching bleeding in depth, and catching bleeders in depth. Next, we move on to the Lane's forceps. The Lane's forceps, it is a short, thick, and bulky. The curved blade with fenestration tooth and groove. So it has a fenestration tooth as well as the presence of the groove. This is used for the holding the bulky and slippery tissue. That is also presence of the gland during the surgeries. Next is a plain dissecting forceps. So the plain dissecting forceps is a very common forceps. The next one will be the Desjardins Colidoco lithotomy. So Desjardins Colidoco lithotomy forceps. So what is special here? It is a curved shaft with a curved blade. It is a curved shaft. It is a curved shaft, and there is a curved blade. There is no catch to prevent the crushing stone. There is no catch to prevent the stone crushing. And the uses is the stone removal in the cholecystectomy as well as a cholecystectomy. Then we move on to the Rendell's kidney stone forceps. So what is special here? So here there is a curved and angulated blade with fenestrations. So what about these fenestrations? So there is a transverse serrations at the inner surface. Transverse serrations. They are present on the inner surface. Next, there is no catch to prevent the stone crushing. No catch to prevent the stone crushing. Uses is the stone removal with different angulations. Stone removal with different angulations. Then we move on to the suprapubic cystolithotomy forceps. Suprapubic cystolithotomy forceps. So what is special here? So here there is a curved and a spoon-shaped concave blade. Spoon-shaped, and it is concave blade. The spicules form a grip over the stone. So there forms a grip, and it is used for the removal of the stones during the suprapubic cystolithotomy. Next is the Chiattle's forceps. The Chiattle forceps is a large sedation. It is curved dipping blades. So there is large serrations. There is a curved dipping blade. Next is it is kept dipped in the antiseptic solution. So Chiattle's forceps, there is angulation, there is a curved dipping blade. It is kept dipped in an antiseptic solution, and the uses is it is picking the sterile objects. So picking or sterile objects to avoid the contamination during the transfer. To avoid contamination, and this occurs. This is during the transfer. Then we move on to something known as the Lister sinus forceps. So Lister sinus forceps, it has a straight blade. So this is it has a straight blade, and there is a blunt, round, olive pointed tip. So there is a blunt, round, olive pointed tip. And next is it is a transverse serration is present. So transverse serrations are present where it is present at the tip. And the uses, what is the use? The uses, there is exploration sinus tract, exploring the sinus tract, and the incision and drainage by the Hilton's method. So there is incision and also presence of drainage, and this is by the Hilton's method. Then moving on, we look into the pile holding forceps. So pile holding forceps, it includes the fenestration. It is a strong curved blade with fenestration. So strong curved blade, and this is present during it has fenestrations. The uses is it is for holding the pile mass during the pile surgery. So it is used during the pile surgery. And what about the ovum forceps? The ovum forceps is a spoon-shaped tip with fenestration. So it is spoon-shaped. It has presence of the fenestrations as well. The uses is it removes the placental fragments. So remove placental fragments, the small endometrial polyps, then the extracting stones from the gallbladder. Next is the card holding forceps. The card holding forceps is also known as a veneering, and this includes two semicircular blades with a circular opening when closed. So it includes two semicircular blade. So two semicircular blade with a circular opening when closed. So it has a circular opening as well. Next is what is the use? The uses of the semicircular blade is to isolate the cord structures. So isolating cord structures, and this is during the sac dissection. During sac dissection, then retracting the cord away, and from the side of the repairing during the hernia surgery. From repair, and this will be during the hernia surgery. To learn and grow daily like this, please do subscribe.